Hello, my name is Jason Aldred. I'm a neurologist and movement disorder specialist in Spokane, Washington, based at Selkirk Neurology and Inland Northwest Research. Today we are going to discuss general questions and concerns that have come up from patients regarding the coronavirus pandemic, with recommendations on best practices and how to keep you safe and yet still receive the medical care that you need. First and foremost, it's very important to follow the Centers for Disease Control recommendations for preventing the spread from coronavirus. cdc.gov is a good recommendation that I can make for a website where you can find more information. It's important both at home and also even more so outside of the home to wash your hands frequently after coming into contact with any other person, and when you do come into closer contact with groups of people, to stay at least 6 feet apart and practice social distancing very strictly if you do have to leave your home. Several key principles that have been highlighted by the CDC for preventing the spread of coronavirus and reducing your risk are to practice social distancing. This means to avoid all non-essential travel and stay in your home, stay put. Essential travel for groceries or medical appointments is permitted if you need to make these visits. Overall, travel and leaving the home should be kept at an absolute minimum and only for essential travel. Specific concerns exist about a person with Parkinson's disease having more severe illness or be at risk for serious injury or death from coronavirus. This is a valid concern and one you should take very seriously. Again, the most important thing you can do is to stay at home and distance yourself socially from other people until instructed to do otherwise by authorities such as the Centers for Disease Control. In particular, those with Parkinson's disease who have difficulties with swallowing or breathing or have a history of pneumonia are at an increased risk from complications of a coronavirus infection. Any concerns that you have about Parkinson's disease and developing coronavirus infection should be discussed with your doctor if you think you may have an infection or have signs of an early infection, cough, or fever, or difficulty breathing. If a person with Parkinson's disease becomes infected with coronavirus or has symptoms of coronavirus, it would not be unusual to expect Parkinson's symptoms to somewhat worsen during infection, as this is commonly seen with colds, bladder infections, or other sources of infection. In general, you should continue taking your medication as directed. Any specific concerns that you have regarding your Parkinson's disease symptoms and medication taking should be directed to your doctor as soon as possible. In the state of Washington, there has been a temporary ban on elective medical procedures to enable other medical resources to be diverted to the source of highest need for the outbreak. Deep brain stimulation is considered an elective procedure for Parkinson's disease treatment. At this time, many hospitals are avoiding operating on deep brain stimulation cases and performing these procedures unless there's some issue directly and urgently related to the safety of a person who has a deep brain stimulator device. People with Parkinson's disease who have a deep brain stimulator device and any concerns or questions are encouraged to reach out directly to the physician or care team responsible for their deep brain stimulator device first with any questions over the phone or via telemedicine visit. Authorities have recommended that patients in general, or those who take medications, obtain a 90-day supply or an extra supply to back up medication that you already have for Parkinson's disease, so that you don't have to leave the house in the event you become ill in a situation where you could infect others if you have a coronavirus infection or other illness. And we do encourage our patients at Selkirk Neurology to fill their medications and have an adequate supply so they're not in need of medication in a situation where they're running out of medication if they're ill. Please address any concerns that you have about the safety of over-the-counter flu medications or other over-the-counter cold medications to your primary care provider or neurologist or movement disorder specialist. Only they will know if there's medication that you're taking for cold or flu would be safe to take with anti-Parkinson medication. We encourage patients to reach out to their providers to determine if the office is open for patients to be seen in clinic. At Selkirk Neurology, we are currently converting our office visits over to telemedicine and providing that option for patients. This is a time of great change and need for innovation to allow patients to continue to receive subspecialty and specialized care for Parkinson's disease. Please consider a telehealth option if that is available from your provider and their clinical location, as this can allow you to receive medical care in your home and remain safe and at a social distance so that you have decreased risk of developing a coronavirus infection. A telehealth or telemedicine visit is very much like a video chat where the doctor is on one end at their office and a patient is on the other end in their home and is able to have an interview with the provider, have many aspects of a basic examination performed, and then receive appropriate medical counseling regarding the needs of change in the medical plan of treatment or other options for diagnostic testing or medical care. It is important to do your best to keep your regular doctor's visits so you don't suffer untoward health complications from missing routine clinic visits. Please reach out early to your provider's office to determine if the option for telehealth or telemedicine exists for you and inquire about how this may be possible. Our experience so far with telemedicine at Selkirk Neurology has been very positive, and most patients are very enthusiastic to consider this as an option. It's not unusual to have some hesitancy towards learning about telehealth as an option for your medical care. But I want to encourage you that even those that have minimal comfortability with technology may find that telehealth is a great option to continue to receive specialized medical care from the comfort and, in this case, safety of your own home. Many patients wonder if telemedicine is covered as a benefit under their current insurance. The federal authorities of Centers for Medicare and Medicaid Services have put in place an emergency order to ensure Medicare recipients receive telemedicine benefits from their home as a covered benefit, as the same as it would be covered in clinic. The state of Washington has also issued guidelines instructing commercial payers to cover telemedicine as a covered benefit in the home, as same as they would in clinic. Please reach out to your provider's office for any specific details on this and to ensure that there are no other questions they may have regarding your suitability for telemedicine.